we begin tonight with the information you need to get the most out of Medicare. The open enrollment period is underway and continues through the first week of December. Joining us to answer your questions is Ayse Tokbay with the State Health Insurance Assistance Program, also known as SHIP. Thank you so much for being here.
Thank you for having me.
I want to start with a data point that I didn't know that you just told me, that nationally, the percentage of Medicare recipients who do a Medicare Advantage plan,
yes,
which we can explain, is around 50%.
Yes.
It's a lot different here.
Yes, in our area, in Maryland and the surrounding area, it's about 17%. So that's a bit of a difference. So the markets aren't always the same with Advantage plans.
So what would account for that? I mean, a terrible marketing failure by the
No.
Medicare Advantage people, or?
I think a lot of Medicare beneficiaries would totally negate that theory. They're getting a lot of marketing for sure. It has to do more with where we are situated, right? We have government in our backyard. So there's a lot of federal employees, state employees who don't necessarily have to look into how to supplement their Medicare insurance, and that's what accounts for the difference in that. If you were to go to areas where people go to retire, you'd see a different story. You'd see increased. But here we don't have people who necessarily have to even take Part B, let alone worry about an Advantage plan.
And the reason people are looking to fill in the gaps of Medicare is that there are a lot of gaps. There's a lot of gaps. You know, I obviously do this for a living, and I talk to people from all different backgrounds, situations, a lot of people retiring, a lot of people aging into Medicare. And one of the more common things I see is shock at how complicated, how many moving pieces there are, how the different pieces are not aligned. They don't follow the same set of rules, different kind of rules. It's not intuitive, that there is a lot of different price points and still out-of-pocket costs. A lot of people think you pay into it and they're like, oh, I'm ready to start Medicare, sign me up, and that's it. And I'm like, whoa, 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 no. Yeah, you know, building a system this complicated for older folks to have to deal with is not really a maybe point of pride for the government. But on the other hand, they created the SHIP system, which
Yes.
you're a part of, which does provide free assistance in every part of the state.
There is a SHIP in every county in the United States, and may go by a different name, but at their heart, they're still a SHIP. That's what, you know, what we call them. So there is local help. You know, SHIPs were established when Medicare started becoming a little more complicated, and when they introduced supplemental policies, and they decided they're going to create this program that's going to help peers. So we recruit volunteers. They're usually retired people who've been through this process, and we train them to become counselors, and people come in and they learn from each other.
Let me remind our viewers who have a question Medicare related, send an email to livequestions@mpt.org, and we'll try to get you an answer. What are the big questions you hear from people?
Oh, a lot of different questions. People truly, like, even when you go through this and you learn it, I mean, I know when I first started learning this, it took me a good 6 months to start feeling like, okay, this doesn't sound like a foreign language to me, right? But people ask a lot about Advantage plans. People are petrified of the Part B penalty, so they're always double checking, like, even if you've just finished teaching a segment about how that Part B penalty works, I, without fail, get people kind of just verifying. So let me make sure I understand correctly. And I just think there's also just a lot of misinformation. People tend to listen to relatives and friends, and what people don't understand necessarily is that there's a lot of nuance to Medicare. So your friend can say, I got this great deal, and I hear that a lot. Well, how come my friend? How come my sister? How come my mother-in-law? You know, and it's like, well, I don't know their set of circumstances. So depending on your circumstances, Medicare can look or feel very different to you than it is to somebody else.
What are the traps in that? I read about something, and I can't remember the details, and it may have had to do with like signing up. Maybe it was Medicare Advantage, maybe it was a Medigap thing. You develop a pre-existing condition, or a condition that they consider pre-existing, and then you try to get
to switch plans and you can't?
Oh, well, it has to do, well, parts of Medicare, and this is where it starts to get a little technical, there is no underwriting. But when it comes to supplemental policies, there can be medical underwriting. There are protective windows, like when you're new to Medicare. So there are protective windows where even if I say, if I just had a heart transplant, if I have an iron lung, I had a brain tumor, like they cannot ask me anything about that, and they'd have to sell me a policy at the best rate as if I was the healthiest person in the universe. But once you're outside that window, it's a different story. And what you see is as time goes on, people normally start to call us, like I get calls a lot for people, later in their aging life, right? And then they call us and they'll say, this is getting expensive, I want to shop around. And a lot of times at that point, you might have more conditions, you're older, you're considered more of a risk. And that's when it gets a little tricky. I experienced that with my own father who didn't listen to his daughter who does this for a living and was like, oh, I'm healthy, I don't need a supplement, I'm gonna save money, it'll be fine. And then he got really sick, and when he needed one, no one would sell him a policy because he was in and out of the hospital.
At that point, you still have basic Medicare A and B, which is hospitals and doctors?
Yes, one is inpatient for when you're hospitalized, inpatient, and the other is for your other outpatient regular medical services. So that there's no underwriting. Once you're entitled to those parts of Medicare and you meet the criteria of your age and your status in this country, you can enroll in that, and nobody's going to deny you that. But it's the other parts where it can get a little bit tricky, like the Medigap policies.
You mentioned the penalty, Part B penalty.
Yes.
That's if you don't sign up at 65?
That's if. It has nothing to do really with your age. It's really whether are you avoiding it, right? If I have other insurance, like I'm currently working and I turn 65, and I plan to keep, and a lot of people are working later, way beyond 65, right? So if I decide I'm going to retire at 72, if I didn't take Part B when I turned 65 because I had current employer insurance, I'm not going to be penalized for that. Or let's say I retire at 65, but my spouse is still working and I'm on their insurance, I'm not going to be penalized. But if I turn 65 and I don't have any other insurance, and I say, well, I've been pretty healthy, I'm going to save some money and maybe I'll defer this for a year, then you're going to get a penalty.
This is interesting. Email question and point from a viewer. I'll start with the second part. Medicare Advantage plans don't travel very well, and many D.C. area people are geographically mobile.
Yes.
Maybe that's part of it. And his first part, employers continue secondary coverage after retirement. So for people fortunate to have that sort of coverage, how could that interface with Medicare?
Well, I mean, that's kind of what I talked about in the beginning when we were talking about the statistics, right? So for example, if I am a federal retiree, I'm getting insurance through my employer, I have retiree coverage through them. And perhaps, I sign up for Part A because it's premium free, I've paid into it. It's not a great secondary insurance, but it's like it doesn't hurt, so why not, right? But Part B is a different story. So we do get a lot of federal retirees who come to us and question, should they take Part B or not take Part B? And we jokingly say to be or not to be, And
that's really useful.
Yeah, but they're trying to figure out, is it worth it? Is me purchasing another insurance and paying another premium worth what it's going to save me and how it coordinates with my current insurance? So, and then there's other things, nuances to that too. A lot of times retirees are put off by the Part B premium because if you make a certain amount of money, you'll have to pay more. So a lot of times they look at that and they're like, oh, I don't know if I want that. There's no right answer, It's how you feel about it. I mean, I've met people with B and they love it. I've met people who don't take it and they're just as happy.
Viewer wants to know about prescriptions. Why do prescriptions become much more expensive in 2025? Is that the case? Because something's getting better in 25.
Yeah, I don't know if they're getting more expensive, and even if they do, it is a new thing that's happening in 2025. I personally am very excited about it. I see a lot of people who can't afford their medications, and in 2025, there's going to be a $2,000 cap for your out-of-pocket spending at the pharmacy when you pick up your prescriptions. So if you have had a history of really expensive drugs and you've spent more than $2,000, that is not going to be the case in 2025.
How do you get that? Can you get that with an Advantage plan, or you get that by having parts A, B, and D?
It is your prescription drug coverage, which is either going to be a standalone prescription drug plan, or it's going to be the drug plan that's embedded in the Advantage plan. But if you're getting your medications through and using Medicare insurance to get prescription drugs, you're not going to spend more than $2,000.
Okay, this question from John really gets to the heart of this. How do I choose between Advantage and Supplement? Said he called Medicare and it didn't go well. How would you answer that question?
Listen, I always feel like when I say this that somebody's going to get me one day. But my response is always, it depends, right? There's a lot of moving pieces and a lot of variables. I mean, honestly, if you're looking for somebody to really sit down with you and talk about the differences, I do encourage you to find your local and ship and help. But I'll say this. There's no right or wrong answer. There's a trade-off to both. You know, what people like about getting a supplemental policy is, and I think that previous question kind of touched on it, like with how Advantage plans don't travel well. But people who get supplements, I say that path, which we call original Medicare, is a very don't tell me what to do path, and people don't like to be told what to do, meaning I don't have to worry about a network. I don't have to worry about a referral. If I have a cardiologist and I know I have a heart condition, I can just go see him, and as long as it's medically necessary, it's going to be covered.
This is regular, plain
Yes.
vanilla Medicare.
Yeah, and if you get a supplemental with that, and then it travels well. You know, there, like I said, no network. So if you're somebody who goes and visits your kids across the country part of the year, or you just travel a lot within the United States, you're not worrying about, oh no, who am I going to go to? Like, as long as they take Medicare, that supplement travels with you. But Advantage plans is a different story. It's got rules. So you're not going to miss out on any of Medicare's protections or rights as you would if you were just going straight through Medicare. But in this managed care path, that's what it is. These companies are being paid a set amount per beneficiary, and then it's up to them to manage your health care, and you know, they're going to make a profit off that somewhere. So they may require referrals before you go see a specialist. They're going to essentially kind of guide you through everything. They have certain rules. You're going to stay in a network. You're going to use their providers. Some force you to stay in network. Some charge you more to go out. If you travel, listen, if there's an emergency and you're having a heart attack, it doesn't matter a network. You're going to whatever's closest. But if I sprain my ankle in California, right, I might have to call them to say, hey, how do I take care of this? And then follow their instructions.
Maybe one way to approach these unanswerable questions, where there is no wrong answer, is regret avoidance. So if I'm going to make a difficult decision here, maybe I just want to minimize my chances of making a mistake.
Yes.
Like, what are the mistakes that you see people make and regret, and you would advise people in the future, don't do that?
When people, there's two things I see. You know, no, and this kind of touching on this question as well. You know, what people don't like about supplemental policies is there's another set premium, whether I'm using the services or not. And while that's also true for Advantage plans, they can be lower, not always, but there are lower cost options. And that's where I see people make mistakes. They're looking at, and you know, and in all fairness, sometimes it's necessity. Sometimes it's you can't afford a supplement, so I have no other choice but to go here. But a lot of times people will see the marketing, or they'll talk to an agent and they'll say, oh, it's a zero premium. And they'll hear about, oh, there's dental and vision in Medicare Advantages. And those are supplemental benefits, right? And I'm not saying they're not important to have, but they're also, unless you're paying an additional fee, they're very basic. It's not a root canal, it's a cleaning. And these are supplemental things. So I see a lot of people making decisions based on that. And then when they have real healthcare needs, like they need to, they get cancer and they're in and out of hospital, they need treatments, that's when the charges start accruing. I mean, healthcare is most affordable when you're healthy and not using it, right? And when you're in and out of the hospital, they see the price tag adding up, and they just didn't do the homework to understand what it would mean.
Viewer would like me to ask you about the income tiers for Medicare Part B.
It's in IRMA. Don't ask me to tell you on the spot what that stands
not
for.
numbers, but generally,
Yeah.
what is it?
So it's kind of what I talked about with, that's sometimes a concern with federal retirees, whether they want to take Part B, but obviously if you're not a federal retiree and you just have Medicare, you're facing this issue too. There are income tiering, and you will pay a higher premium for Part B and your drug coverage as well, depending on your income bracket, and that's where you fall in. So a lot of people who retire get nervous because they're like, well, I'm retiring, right? And my income's not going to be the same. And Social Security determines that based on your income tax from 2 years ago. But, if you're somebody whose income is decreasing as a result of retiring or no longer working, you can tell them and they'll make an adjustment accordingly.
Best way for somebody to get reliable help. Let's start with the SHIP program.
Yes.
In your local county, call the Department of Aging.
Yes.
And what else is out there?
1-800-Medicare. I know someone just texted me, but they are going to give you the technical correct answer to things. We use Medicare's website a lot and refer people to Medicare's website. They've really done a great job of building on that and making it a lot more user-friendly to people and helping them navigate it. That's another good source as well.
Very good. Ayse Tokbay is Program Manager with Howard County's State Health Insurance Assistance Program, or SHIP. We appreciate your time. Thank you so much.
Thank you so much for having me.